Most dentists aren't trained to run businesses, let alone scale them. This is the TechDental Podcast for dental leaders who want more than just tips. We give you systems, strategies, and straight answers. I'm Dr. Randeep, and each week I sit down with the operators, AI founders, entrepreneurs, and business leaders who are reshaping what's possible in dentistry. If you want a smarter, scalable, future-proof practice, then this is the podcast for you. Welcome back to the TechDental Podcast. I'm your host, Dr. Randeep, and today we're diving into one of the biggest shifts happening in dentistry right now, the reinvention of clinical education in the disruptive age of AI. We talk a lot on this show about AI, automation, and digital workflows, but none of that matters if the profession isn't equipped with the skills needed to use those tools confidently and safely. There's no one more qualified to unpack this than today's guest. Our guest is a world-class educator, operator, and innovator. He spent more than 20 years at the intersection of clinical practice, educational leadership, and large-scale operations, including oversight of hundreds of practices. He's now Director of Clinical Education and Operations at Spear Education, one of the most respected clinical training ecosystems in the world. And he's a leading voice in hybrid learning, AI-driven skill assessment, and the future of competency-based dentistry. I'm excited to welcome our guest today, Dr. Vishal Sharma. Vishal, welcome to the show.
Thanks, Randeep. I appreciate the introduction. I've been a big fan of your podcast, so I'm excited to be a part of it today.
You've spent decades across clinical practice, operations, and now education. At what point did it become clear to you that dentistry has a structural skills gap and that the old way of training simply wasn't keeping up?
I think it was probably post-pandemic, and the lack of clinical training was really exacerbated by the pandemic. We know that universities worldwide, dentists are now graduating with less clinical skill sets than they did a generation ago. So I think the pandemic really exacerbated that. It certainly introduced us to remote or virtual learning as well. So it afforded us the opportunity to take what was good of virtual learning, what could be augmented, and then really take those learnings and lessons and opportunities and apply them to dentists who are maybe coming out of dental school without the same clinical skill sets that they've had in decades or generations past.
That leads us perfectly into where dentistry is today. Clinical complexity has exploded. You've got digital workflows, advanced prosthodontics, occlusion, surgical planning. The bar keeps rising, but the curriculum hasn't evolved at the same pace. Where do you see the biggest gaps showing up on the ground, especially with early career dentists?
I think it's diagnostic skills, interpersonal skills in terms of treatment planning with patients. Our patients now worldwide are much more savvy. They're digitally tuned in. They have unlimited amounts of information at their fingertips, ChatGPT, Google reviews, etc. So they're savvy, which is fantastic. Now you have a profession which is increased in complexity, Randeep, as you just said. Now there's clear aligner therapy, implantology. People are keeping their teeth for a lot longer. So how do you now provide the same time frame, 4 years of dental school? How do you upskill those practitioners to have a much more sophisticated, broader depth of skill sets that are required? How do you give them all that information in a shorter period of time? That's one of the big challenges we're seeing in early career dentistry, recent graduates right now.
And of course, even when clinicians want to upskill, the barriers are real. Time off the chair, travel, faculty availability, cost, inconsistent training standards. You've looked at this from both the educational and operational sides. What are the practical blockers that stop clinicians from getting the depth and repetition they need?
I think you hit the two main components. The first is going to be time. Right now, everyone's time is going to be limited. When you're in clinical practice or private practice, it's a much more competitive landscape today than it was 10, 20, 30 years ago, certainly. So now you have clinicians that are needing to work evenings or weekends to satisfy the financial requirements that they and their businesses have. Debt loads are astronomical. It's not uncommon for someone to come out of an American dental school, $500,000 US in debt, which is incredible. When I started my career, you could build a practice for $500,000. Time constraints, obviously limitations on cost. Travel is certainly much less glamorous than it was in the past, less predictable. So I think those are the three main barriers to early career dentists and even those past those foundational years where they're looking to build their skill set. Those are the three biggest barriers: time, cost, and the difficulty in traveling.
You've also led clinical operations for huge practice networks. You've seen patterns across hundreds of clinicians. What kinds of underperformance did you notice that connected directly back to education or lack of structured development?
Yeah, I think dental school is fantastic because it provides you with a base level of skills. And obviously, it's a sheltered environment. So you're going to have professors who are going to be helping you along the way, which is great. But the other challenge with it is a lot of the disciplines are segmented. Here's endo, this is restorative, here's prosthodontics, et cetera. Whereas in clinical practice, Randeep, we know that's not the case. You have a patient who comes in, they don't know which discipline they need. It's a multidisciplinary approach that we have to take. So now you go from a sheltered, structured environment where you have these segmented skill sets, and you now go into an environment which is not sheltered, certainly not streamlined. You have to build that. And you now have to take all of these disjointed skills that you learn, package them together to be able to execute them and provide a patient with exceptional care. So that's challenging. That's a challenging scenario, especially now given the fact that you've got implantology, clear aligner therapy, all these AI tools, which 20 some years ago when I graduated, none of those things were really foremost in dentistry or front and center in dentistry.
Yeah, I really second that. I remember from dental school, you were taught really well, but it was very siloed. Each department had their own way of doing things, and it taught you those disciplines well in isolation. But the reality of clinical practice is it's messy. The patient comes in and they don't fit into neat categories. I definitely understand that sentiment. It's a real challenge.
Just to even expand on that, like when I was in dental school and probably also when you were in dental school, this was never verbalized, but the unspoken word was that at the age of 55, 60, your patients would end up in a denture. And that is not the case now. Like we have patients coming in their 20s or 30s or 40s who are potentially expecting to live to be 100 plus years of age, and they're wanting healthy dentistry. So I don't think our treatment modalities have kept up with patient expectation, and maybe not life expectancy, but at least tooth life expectancy. So yeah, you're right. It's become much more challenging and demanding on the dental professional. But from a patient perspective and a societal perspective, those are great changes. As a profession, we just have to do a better job of keeping up to them.
Yeah, that's a vital point there. And the increase of modalities as well with AI you mentioned coming in, and we'll come on to some of the tech. It's great, but it's also added a lot of complexity. So we need a structured pathway for that as well. For clinicians who only know traditional continuing education, we call it CPD here, you call it CE, it's the same thing. Hybrid can sound a little bit like adding videos to a curriculum. But what the Spear ecosystem is very different with is how you define hybrid dentistry and what does integrated mean versus segmented. Could you just unpack that for us, please?
Well, let's start with the integrated versus segmented. So traditionally with continued education, you would look at a pain point or a skill set that you wanted to learn or a pain point that you wanted to solve, and you would take a siloed piece of CE or CBD, and that's the path that you took. Now, the challenge with that is it requires a lot of self-awareness. So you have to understand what your limitations are. And Randeep, what I've found in my career and evaluating the careers of peers or people that I've observed is you can assess in posterity and say, that's where I lacked a skill set. But while you're going through that process, it's difficult to know, as the old saying is, what you don't know. So if you can have a more structured, linear, a pathway or a program, if you will, that takes you from A to Z in various skill sets, various disciplines, you're covering everything. And then you're not relying on a dentist to self-assess themselves to identify what they don't know. Because again, sometimes you just don't know what you didn't know until much later on. And if you're waiting until later on, there's lots of mistakes, costly errors, and other challenges that you're going to see. So that's the approach that we're taking with education right now, to be more proactive and to build programs and pathways that satisfy the requirements that we know dentists at any level of experience need.
Vishal, what I find most interesting is this decentralized model. Clinicians learning foundational theory online, practicing skills in their own environment, and then receiving remote faculty feedback.
Yeah.
This solves the accessibility challenge without diluting the rigor. Why has that combination, this decentralized practice plus remote mentorship, been such a breakthrough?
You were talking about sort of the hybrid model. So when we discuss the main challenges with continued education right now, time, obviously cost and travel. It solves all of those components. So you can utilize your own clinic or the comfort of your own home, preferably your clinic if you're going to be doing hands-on exercises, and you're able to execute those exercises at home. What we utilize now is objective information, objective data collection to assess those workflows. So we now have scan data that will tell you whether you're objectively and numerically reducing your preparation to the appropriate microns based on the material that you've selected. Dentsply, Sirona, iTero, they now have scanners that are going to tell you how rough or potentially how smooth your preparations are. And we know that as you're prepping a tooth, the more smooth those margins are, the less marginal leakage you'll have, the better marginal integrity. So we can give this an objective analysis, much more consistent with the profession than the subjective analysis that we would have in dental school, where a prof would be looking at it. And they had criteria which they would use to assess that exercise, but it wasn't as objective or numerically accurate as the profession of dentistry has moved. So, that's the benefit of the hybrid model. Obviously, there's on-demand videos, there's live videos. So not only do we do it in real time, but it's asynchronous as well. And Randeep, all of it eventually leads to still an in-person workshop. I still think you cannot substitute the energy, the collaboration with your peers, and the interaction with the renowned faculty member. I don't think you can substitute that, but these do a great job of augmenting that.
And when we look at scale, DSOs need consistency. They need learning pathways, not random CPD events. How are DSOs using structured role-based pathways to standardize expectations across associates, hygienists, and wider teams?
Every DSO is going to have their own standard operating procedure. They're going to have their own values that they've established. And that's important. You want to establish the identity of your organization, regardless of what business you're in. Right now, the challenge is any of the clinical expectations that we have or the standards are set by the regional boards. So they're not company specific. In order for a DSO to establish what their expectations are for their admin team, their dentist, their hygienist, et cetera, you have to be able to demonstrate what those expectations are. So this is the standard. This is what we're aspiring to. And in order for us to get to that standard, there has to be some educational component that supports that vision. So it's difficult to scale that education. So what we're doing at Spear is we're working with various DSOs to determine what their clinical standards are, what's important to them. For some organizations, it's scan every patient. For other organizations, it's same-day clinical dentistry. From a hygiene perspective, maybe it's GBT or utilizing oral DNA, et cetera. So we take what's important to them from their clinical values. We then, of course, can cater the education and the pathway to ultimately achieve what they're hoping to accomplish. And if you can standardize that across the entire network, now you've established the level of clinical competence that you want for your particular organization. So it's really exciting. Coming from the DSO space, it is a lot of work for an individual DSO to do that. It's costly, it's time consuming. But at Spear, where we're working with dozens of DSOs, really it's just a matter of customizing a template that works effectively, is proven, is a successful template, and catering that to the respective DSO. So that's how you establish the clinical expectations, the baseline as to what your organization wants to accomplish, and then how you customize that respectively.
What transformations have you seen when clinicians move from hours-based CE to true competency-based progression?
We still are beholden to the state, or in my case, provincial licensing bodies that say you need this number of hours. But really what you're looking for is impactful education. It's not a question of hours. This is the pain point that you're looking to solve. This is the growth opportunity that you want to accomplish. What do we need to accomplish those two things? Solve a pain point and add an additional skill to improve our professional expertise. And regardless of what the hours are, for some people, it's going to take them longer to get there, but we have pathways and programs that allow us to sequentially and segmentally gain the necessary skills to continue on that progression. And there's nothing wrong if it takes someone longer to gain the confidence to, say, place a guided implant. There's nothing wrong with that. But ultimately, we want to ensure that they're comfortable with the diagnosis, they're confident with the execution of treatment, and they understand all of the aspects so they can provide that service to their patient as effectively as possible.
Let's segue into something that's going to define the next decade of dental education: AI as a skill evaluator. Diagnostic AI is now mainstream. Radiographic detection, pathology scoring, patient communication support, but procedural AI feels like the real unlock. Why is objective skill evaluation the missing piece in dental education?
That's a great question. Randy, our profession has become so focused on objective data, right? We know the thickness of materials to microns. We know the strength of various dental procedures and materials and restorative modalities to the megapascal. So it is such an objective, numerical-based profession. Dentists, we love our numbers. And so it follows suit that the assessment of our clinical skill sets, either as dental students or as we pivot into career and we start to learn these new skill sets, you would want to have that objective numerical data. So when you have a subjective human-based analysis, there's always a subjective component to that, where with the scanners that we have available and these AI tools, they satisfy those objective numerical expectations that we have in the profession. And now they're transferring over to clinical educational assessment as well. So it's a harmonious fit.
I think that you've answered my next question. I was going to ask, how does that compare with traditional subjective faculty review? So what I'm getting is it's very much human in the loop, collaborative approach. You've got the AI there, but what's your view on the traditional way of reviewing preps?
There's a place to it. And I'll walk you through one thing that we're doing at Spear right now. We've just fulfilled a proof of concept with one of our DSO partners where we are sending models to their participants at the comfort of their own practice. And they have videos and exercises that they will do on the model. So preparations of a crown and inlay and onlay, et cetera. So we have the master cast scanned in their office. Once they've done their preparation, they're going to scan it with an intraoral scanner. And now, based on the material that they've selected, we have objective scan information that will tell you whether the appropriate reduction has occurred, whether the preparation is as smooth as it needs to be. We're getting them to finish with the 40 micron red diamond burst. We want to make sure that the margins are nice and smooth. So there is that objective numerical assessment that we're utilizing our digital tools for. Now, simultaneously, they will be sending in photos or even mailing back their model if they prefer. And we will have one of our senior prosthodontic faculty members review it underneath a microscope. So they're now able to give subjective analysis as well. So I think having a combination between the two is the ideal sweet spot. Eventually, I'm sure that subjective human-based analysis is going to start to wane. It seems like the entire world is trending towards digital assessment, digital support, digital fabrication. But for the time being, we're combining both. In answer to your question, I think there's a place for both, but the objectivity is certainly something that's been long overdue and is a welcome addition to that assessment protocol.
And Vishal, a big question for me is the confidence gap that we see in new graduates. They know the theory, but they haven't repeated the procedures enough to maybe trust their hands. Can procedural AI help to close the gap by giving real-time, objective, repeatable feedback? What's your experience with that?
Yeah, it's still in development, but you're right. The best way to learn, of course, is on the spot. When we talk about associate development or developing team members over the years, providing positive but constructive feedback as quickly after the event as possible, whether it's a positive event or something that leaves the opportunity for improving, that's the best way to do that. So if you can go through a preparation exercise or an endo exercise and you're filing and the AI can tell you immediately where you're making a mistake with instrumentation and putting the file at risk for separation, et cetera, that is such a fantastic way to learn. Much more effective than waiting to see whether it's successful or whether it's a failure later on. I think this is much more proactive, and learning in the moment is certainly a more effective opportunity to improve your skill set.
And looking ahead, where do you see the early wins of AI-driven skill assessment? Is it faster skill acquisition, fewer errors, more predictable outcomes, or standardized competency before someone even touches a patient?
I think the main component, of course, is going to be faster skill acquisition. So historically in dentistry, you would come out with an ability to do some fillings, extractions, maybe some root canals, maybe a couple dentures and the occasional crown and bridge. And that was really it. And so you go into practice and you make mistakes, and it was just accepted that mistakes were part of the growth of the profession. Now with the more digitally savvy patient base, I think people are less amenable to professionals learning on the job. And that is totally understandable. We have tools that can allow us to circumvent that. So you have the base skill set coming out of dental school, whether it's the first year or the first couple of years out of there. Now, if you're utilizing AI tools to improve your efficiency on fillings, improve your efficiency on crown preparations, et cetera, not only does it benefit the practitioner, but it also has an immense benefit for the patient and the public as well. So I think that is one major component. And that ties into the fourth point that you made, where not only is your skill acquisition going to be faster, but it's going to prevent errors on the public and patients, which benefits everyone, the professionals, patients, et cetera. So that's where I see AI supporting most effectively.
We spoke a little bit about scale and DSOs earlier. When DSOs grow quickly, where does education typically tend to break first? How does a hybrid plus AI model solve the bottlenecks better than, say, legacy CE systems?
Yeah, I think one of the challenges with DSOs, and coming from this space, we certainly went through this when I was the director of clinical operations for our Canadian DSO, is what the clinical directors are looking at is they're looking at what's made their career successful, the CE that they've taken, the protocols that they implemented within their office. And now they're looking to scale that over dozens, if not hundreds of offices. The challenge or the fallacy there is that chief clinical officer typically is exceptional. So the challenge is you can't scale those programs that made them successful because you can't scale them. You can't duplicate or replicate them or clone them. What traditional CE entails and what DSOs have historically done is they will offer one-off pieces of education. So here's a socket preservation course. Here's a direct restorative course. Here's a course on veneers. But there's no cohesive linking of all of it. And I think that disjointed nature still speaks to some of the shortcomings of dental school, where it's not multidisciplinary, it's not cohesive, it's so segmented. So I think what DSOs, especially because they're attracting a lot of new grads, for many new grads, their first job is a DSO. How do you build a pathway that encompasses everything from patient communication, interacting with your dental assistant, being a good team player within a dental office that's already established, things that you certainly don't have to worry about in dental school. And then as you're seeing these patients that have complex problems, how do you plan multidisciplinary treatment? And do you have the appropriate skill set to treat it, or even the understanding and knowledge to know that you have to seek help or a referral or another colleague on that? Yeah, I think that's one of the challenges that DSOs are facing. I think that's what they've traditionally done, but we're starting to see certainly a shift in their education.
Looking more future facing, and you may have touched on this in your previous answer, but if we look ahead, say 5 or even 10 years, what does a fully integrated learning ecosystem look like?
Yeah, I think it's related to a patient. So you're going to have some virtual reality goggles on. It'll be immersive. So, you'll have the audio inputs from a clinic, and you might be sitting at a tabletop, but it's going to appear as if you're in a clinic. And you might be working on a printed root canal 3D model, but that'll be part of the patient. And so that patient will be interacting. They'll be talking about the pain that they're experiencing, what their symptoms are. So not only are you going to have to learn the skill set in terms of the mechanical instrumentation, but everything from the diagnostic aspect to dealing with a difficult patient who's going to be in pain, things that maybe are not effectively supported in dental school, and certainly skill sets that are difficult to learn via a webinar when a dentist is just talking about this. So that immersive experience where you have all of the sensory inputs, the overwhelming sensory inputs that you have within a dental environment, that to me is really effective, exciting dental education. So in 5 years' time, Randeep, that's where I see education, all VR and augmented VR, and really upskilling our dental professionals at a much faster, more efficient rate.
We're almost coming to the end of this segment here. And what I like to do towards the end of these podcasts is have a lightning round where we have some quick fire questions. It's designed to get a little bit into your mindset. Here goes, not to put you on the spot, but whatever comes to mind first. So what's one piece of digital clinical tech that you rely on daily?
Oh, the CERAC, single visit dentistry, has been incredible. It's a great practice builder. Patients love it. It's opened up the opportunity to do more conservative restorative dentistry, and I don't miss temporizing posterior teeth at all. So CERAC, that's my go-to.
Yeah, that's my favorite too. You can't beat a good CEREC. And what hybrid learning innovation do you think will be everywhere in the next 3 to 5 years?
3 years might be a little bit aggressive, but 5 years is that VR augmented or virtual reality augmented support where you've got virtual reality glasses and you have all the inputs on there. You have patients, virtual patients that you will say something to, and they will respond based on your communication. So that to me is where the future of not only dental school education will be, but also postgraduate education as well.
And what's one myth about AI in dentistry that you'd like the profession to drop? Or what do you think is coming in, which is really more hype than reality?
I think the main myth is that it is a future application. Like, it is here. And we know right now that there's AI radiology. The machine learning capabilities have made that advance so rapidly. You know, what these programs looked like a year ago, they've evolved significantly. I have been working with Dentsply Sirona's new AI design tools on crowns, et cetera. I know it's coming out with diagnostics and diagnostic support. So some of it, of course, is future application, but the myth is that it is future application. It's here now. Best for dental professionals to embrace it. You certainly don't want to get left behind on this aspect and make your career obsolete. So it's here now. That's the myth is it's not a future application. It's here today.
Yeah, I definitely agree with that. It's here and it's already embedding everywhere, and it's best to be ahead of the curve. That's what I'm hearing from a lot of my guests and from what I see on the ground here. And finally, Vishal, if you could collaborate with any innovator or entrepreneur inside or outside dentistry, who would it be and why?
Well, that's a great question. I think the top person would be actually Walt Disney. And the reason is when I was building practices and purchasing practices and was at the height of my retail dental career, before DSOs and before education, the patient experience was my North Star, was my guiding light. And Walt Disney with the customer experience just was so sophisticated and nuanced in the way that he approached things. And he built a customer experience which was unrivaled, unparalleled, and unprecedented. I remember reading components where he would, when he was building his theme park, he would give people candy or gum at the front, and he would have people count the number of paces until they were going to spit that or dispose of that piece of candy. And that's how far he put the garbage cans apart. So just that level of attention to detail on your customer is really inspiring. And we never achieved that within our dental offices, but that was the guiding principle for us. And I think being able to have a conversation with him and learn a little bit about the mind of Walt Disney would be really inspiring.
Where can our listeners connect with you and the wider Spear Education ecosystem?
Well, speareducation.com, we've just relaunched our website for 2026. We'll be having a next generation learning experience. So we are really at the forefront of what post-grad dental education will look like. We're innovating. We are working on new protocols. We're testing new concepts. Visit our website, and certainly there's lots of information there. You can reach me on LinkedIn, just my name, Vishal Sharma. Reach out to me if, as an individual, part of a DSO or a group, if you need any direction or want to collaborate, I'm always open and I'm hyper responsive to electronic communication. That's probably the best methods to get in touch with us. And I'm always open to dental conversation. So please reach out when you can.
Vishal, thank you for sharing your insights. I'm your host, Dr. Randeep, and this is the TechDental Podcast, giving you a front row seat to the cognitive age of dentistry where AI, technology, and human mastery shape the future of clinical excellence. If you want to stay ahead of what's coming, make sure you like, subscribe, share, and follow along across all your favorite platforms. You can connect with us at www.techdental.com, email info@techdental.com, or you can reach me directly on LinkedIn. Thanks for tuning in, and I'll see you next week for another action-packed episode. Scaling a business isn't a dream, it's a decision. This is the TechDental Podcast. And if you found value today, follow, share, and subscribe. This is the edge every dental leader needs.